CS TMC Exam 1. Question 1. A patient with severe ARDS with a pulmonary artery catheter in place is receiving mechanical ventilation via volume ventilator. The patient requires an FiO2 of 1.0 and PEEP of 22 cm H2O to maintain an adequate PaO2. On occasion, the patient becomes combative and tries to get out of bed. Each time this occurs, the high-pressure limit alarm sounds repeatedly and the SVO2 drops below 50%. The RT should recommend increasing the FiO2, administering midazolam, versed, extubating the patient, decreasing the PEEP, administering midazolam, versed. Question 2. 36 hours after initiation of mechanical ventilation, a patient's chest X-ray shows dense bilateral infiltrates. The patient has gained 2.5 kilograms 5.5 pounds and the urinary output is averaging 28 milliliters per hour. Chest auscultation reveals fine crackles throughout all lung fields. Which of the following interventions would be appropriate at this time? 1. Administer a diuretic, yes. Fluid bolus, yes. Suction, no. 2. Administer a diuretic, no. Fluid bolus, no. Suction, yes. 3. Administer a diuretic, yes. Fluid bolus, no. Suction, yes. 4. Administer a diuretic, no. Fluid bolus, yes. Suction, yes. 3. Yes/no/yes. Question 3. During the administration of an ultrasonic nebulizer with half-normal saline, the RT notes the onset of inspiratory wheezes in the left lower lung field. The therapist should do which of the following? Increase the flow rate, terminate the treatment and obtain an order for a bronchodilator treatment, change to normal saline, encourage the patient to cough. Terminate the treatment and obtain an order for a bronchodilator treatment. Question 4. Which of the following is indicated for hypotension that is unresponsive to fluid resuscitation? A vasopressor agent, a diuretic, a vasodilator, a beta blocker. A vasopressor agent. Question 5. A patient has just been admitted to the ED for an acute asthmatic attack. The physician has prescribed albuterol, Prevent, ipratropium bromide, Atrovent, and fluticasone, Flovent. Which of the following is the correct order of administration of these drugs? Fluticasone, ipratropium, albuterol. Ipratropium, albuterol, fluticasone. Albuterol, ipratropium, fluticasone. Albuterol, fluticasone, ipratropium. Albuterol, ipratropium, fluticasone. Question 6. A patient who develops subglottic edema following extubation would benefit from the administration of which of the following? Nebulized racemic epinephrine, albuterol, intravenous steroids, normal saline via nebulizer. Nebulized racemic epinephrine. Question 7. While performing endotracheal suctioning on an intubated pediatric asthmatic patient, the RT observes that the patient becomes severely bronchospastic. The therapist should recommended endotracheal instillation of lidocaine, xylocaine, prior to suctioning, increase the suction pressure, extubate immediately, administer a paralytic agent. Recommended endotracheal instillation of lidocaine, xylocaine, prior to suctioning. Question 8. Higher than normal levels of exhaled nitric oxide generally mean excellent oxygenation, airway inflammation due to asthma, pulmonary embolism, chronic bronchitis. Airway inflammation due to asthma. Question 9. Which of the following should be done immediately following a lung recruitment maneuver? Extubate the patient, perform a decremental PEEP study, decrease the FiO2 to room air, suction the airway. Perform a decremental PEEP study. Question 10. A 36 weeks gestation neonate is being mechanically ventilated. The ventilator settings are PIP 24, RR32/min, I times 0.6 SEC, flow rate 8L/min, PEEP 6 cm H2O, and FiO2 0.45. The neonate's physician is concerned about the volume/pressure loop, which is shown to the right. The RT should suggest which of the following: increasing PIP to 28 cm H20, decreasing PIP to 20 cm H20, increasing PEEP to 8 cm H20, decreasing RR to 20/min, decreasing PIP to 20 cm H20. Question 11. The pressure and flow curves shown to the right were recorded from a mechanically ventilated patient receiving pressure control ventilation, PCV. Using the pressure and flow curves represented in A as the reference, which of the following best explains the change in the pressure and flow curves represented in B? Optimal inspiratory time has been achieved. There is a leak in the circuit. The patient is bucking the ventilator. Airway resistance has increased. Optimal inspiratory time has been achieved. Question 12. When the ventilator rate of a mechanically ventilated patient is decreased from 8/min to 6/min, the patient becomes agitated and the EtCO2 increases from 44 mm Hg to 51 mm Hg. Based on this change, the RT should conclude that alveolar ventilation has increased, alveolar ventilation has decreased, oxygenation has improved. There is an equipment malfunction. Alveolar ventilation has decreased. Question 13. The high respiratory rate and IE ratio ventilator alarms have activated on a mechanically ventilated adult patient who has a long history of chronic CO2 retention. Which of the following is most likely to occur as a result of this situation? Increased oxygenation, decreased intracranial pressure, increased hyperinflation and air trapping, spontaneous pneumothorax. Increased hyperinflation and air trapping. Question 14. Which of the following will occur when the high pressure limit is reached on a volume ventilator? 1. End inspiration, yes. Alarm sounds, no. Deliver full volume, yes. 2. End inspiration, yes. Alarm sounds, yes. Deliver full volume, yes. 3. End inspiration, no. Alarm sounds, yes. Deliver full volume, no. 4. End inspiration, no. Alarm sounds, no. Deliver full volume, yes. 3. No/yes/no. Question 15. While performing a ventilator check on a sedated and paralyzed patient, the RT notes that the mechanical rate is set at 12/min, but the total rate reads 16/min. The RT should adjust the sensitivity settings, increase the sedation, change the ventilator mode, decrease the set rate, adjust the sensitivity settings. Question 16. To increase the VT of a patient receiving non-invasive positive pressure ventilation, NPPV, the RT should increase the EPAP level only, decrease the IPAP level, increase the gradient between the EPAP and IPAP levels, decrease the gradient between the EPAP and IPAP levels, increases the gradient between the EPAP and IPAP levels.